was particularly concerning. But I think reflecting back for me, it was probably the disparity that we saw in social class and who actually had access to treatment and who didn't. And the healthcare system obviously was heavily impacted by the economic challenges, and those who were well off had more choices. They obviously could access treatments in various different places. And so I concluded that when I went to college, I was going to study something at the intersection of business. That's how and health. That's how I described it then, because I looked at the healthcare system and I thought, looks like a business, and I'm interested in health. So that's what I figured I would pursue. So as a fun fact, this is actually the library in my hometown where I spent hours studying for the SAT. I also spent hours there flipping through these huge books of profiles on US colleges and universities, because that's what we had access to. That's how we looked for universities. And actually my high school is only a couple of blocks from where this picture is taken. And because I was particularly good at quantitative subjects in high school, and because of my interest in that business-health combination, I initially was a business pre-med student majoring in accounting when I went to Baylor University for undergrad. So my experience with Baylor actually was great. I think what helped might have been that Waco was a small town. Architecturally, it was pretty flat, so kind of actually looked like my hometown a lot. So adjusting and culture shock weren't really that huge an issue. So after some challenges, some bumps in the road with chemistry and tax law, I decided to be an economics major. I feel like this is where everything started to come together for me career-wise. I really enjoyed economics. We studied populations at the micro level, at the macro level, and actually econometrics particularly was very pleasantly surprising. It was during my junior year that I actually found out about public health as a field. So given my previously mentioned interest in healthcare systems, I applied to the health policy and management programs in public health schools. And I often tell people that I feel like it's evident by the way things came together and kind of fell in place that I was meant to be at Pitt, and that my career path was my current path was set from there. The program director of the HPA Health Policy and Management program here gave me a call and directed me to Jeanette Southpaw, who is the chair of family medicine, for an interview for a GSR position while I was an MPH student, or actually before I started the MPH program. And that would be through HPM and based in family medicine. And thankfully, she offered me the position. This is actually a picture. This is actually a picture. On the left is my mother. On the right is Jeanette Southpaw when they met for the first time. As an MPH student, I helped researchers who were in family medicine with their various projects, including those on HIV/AIDS, youth development, maternal and child health, and education in sub-Saharan Africa. And actually, I remember taking Martha Terry's class, so that was in health policy and management, doing my MPH. Her social and behavioral sciences and public health class that we had to take. And I remember her introducing the socio-ecological model, and it was actually quite fascinating. It was the first time I had heard of the concept, and I could envision how my research interests were impacted or influenced by factors at various levels. So I decided then later I would apply to the BCHS program for my doctoral degree. I continued to work with Jeanette Southpaw throughout my doctoral degree, and I think particularly important to my current pursuit of an academic career was probably my experience as a program director of one of her studies. It was a secondary teenage pregnancy prevention project, which was funded by Heinz and the Grable Foundations. So while it was very rewarding, it was also probably the most stressful job I've had. I found that I was constantly learning on the job. Many times I would change how we did things because I'd all of a sudden learned of some different way of doing something in one of my doctoral level classes. So it was actually quite enjoyable, and I definitely wouldn't change anything about it despite how stressful it was. And I usually think back on why I didn't get as many co-authored, I guess I wasn't a co-author on as many publications as some of my colleagues were in grad school. I feel like I got a hand at trying a lot of different things. For example, I got to try my hand at survey design, recruitment, participant interviewing, writing abstracts, and presenting at conferences, writing funder and IRB reports, and actually hiring staff and training them, doing some of the purchases. And so from the perspective of learning some of the major components of managing a study, I feel like this experience was invaluable. So my research interests were always in maternal and child health and disparities. And so I also look back and remember taking John Marks's theory course in my first semester of my doctoral program. I remember that it was actually extremely challenging, but I really, really enjoyed it. The theories that we studied there shaped a lot of how I conceptualized drivers of inequality, and gave me a tremendous appreciation for having this strong theoretical basis for research that we do. So for my dissertation, I looked at the intergenerational low birth weight and preterm birth associations between mother and child, and how they might be modified by neighborhood disadvantage, and all of this in view of improving our understanding of the determinants of black-white disparities in these birth outcomes. Jesse and Steve Albert, who were my dissertation co-chairs, and they were extremely supportive. They encouraged me to pursue this dissertation project that I was actually passionate about, so I really appreciated that. So I pursued a postdoc at the University of Washington after finishing here. I was part of a T32 training program in reproductive, perinatal, and pediatric epidemiology. I do have to say about Seattle, it is beautiful. I enjoyed it. And it didn't hurt at all that there was no snow the 2 years that I was there, so that was great. I worked with Daniel Ncube, who's the gentleman in the picture, and he really encouraged me to develop my own projects and supported me in that. And then the PI of the training grant was Gail Reiber. My mentorship through her was focused on professional development and career advancement. I worked on getting my dissertation papers published, networking with other faculty at the University of Washington, attending EPI conferences, professional development events, and so on. And I published a couple of papers with some of the faculty that I identified there, building on my racial and ethnic disparities work and my focus on intergenerational transmission of risk. Since I was also enrolled in their MS in EPI program while I was there, I published the paper for my thesis, and that was looking at sex-specific differences in the association between maternal and child birth weight. For me, the additional quantitative training through that EPI program was very important to the kind of work that I wanted or envisioned myself doing, because I wanted to be strong in the theory as well as the methods. I also sought out the opportunity to teach while I was out in Washington. I was adjunct faculty at the Lake Washington Tech in Kirkland. I taught their field epidemiology class to their seniors that were in the EPI track of their Bachelor's in Public Health program. I acquired experience in multiple aspects of teaching through that course, including developing the curriculum, delivering lectures, and designing the course materials, developing and grading the student exams. And at UW, I met some great individuals and very supportive people there. For example, I remember I met a South African professor. There we'd meet for lunch and would talk about various things in career development and as well as work-life balance. And I remember once, her response to my expressed frustration in not having as much time to work out or work out as often, she was a runner. So she told me, she's like, you just have to schedule it, and regardless of how you feel at that time, you just have to do it. You can't give yourself the opportunity to think about, oh, I feel like it or not. So obviously it's easier said than done, but that stuck with me, and I've definitely taken that on. So after Seattle, I moved to Boston and I started my current future faculty fellowship at Northeastern University. At this point, I'm at month 7. I've spent my time there writing an NIH career development grant that I'll be submitting soon, writing papers, establishing community and academic partnerships, presenting at conferences, participating in more professional development, training opportunities, and applying for faculty positions. Next week, I'll be presenting at a campus seminar. Later in the semester, I have 2 guest lectures coming up. And having moved again, it obviously presents me with the challenge of having to then reestablish connections again, people who are key in my field, but so far I feel that I've been fortunate in that area. And also currently I'm working on a couple papers that are looking at the role of life course household wealth as well as life course, neighborhood disadvantage and their impact on low birth weight in Black and white individuals. And then in the grant that I'm submitting, I'm proposing to use a system science method, system science approach to explore some of the mechanisms that by which structural discrimination on the basis of race in sectors such as housing, education, labor, and healthcare create a system of racial inequality, which then perpetuates racial and ethnic disparities in preterm birth. So I guess that's it, and I thank you for the opportunity to share with you.